All right, so I thought I'd take a minute today to kind of talk about blood work. I discussed earlier about going to your doctor and them pulling blood work for testosterone replacement therapy. The standard blood work panels that my doctor pulls on me every 6 months is your CBC, which is your complete blood cell count or complete blood count. Your hepatic panel, which is checks all your liver function, make sure everything goes okay with your liver function. Estradiol, which is the male version of estrogen, and then we pull a free and total testosterone. We pull both free and total every 6 months, and then once a year he'll actually pull a PSA, which gives you an indication of health of your prostate. All right, so on the CBC, generally what he's looking at is to make sure that if you're on testosterone replacement therapy, it can cause you to actually manufacture a higher number of red blood cells, and when you get into an enormously over manufactured red blood cell area, you can cause yourself some issues with heart health, with overall general health. I have in the past, when I very first started doing testosterone replacement therapy, my numbers start creeping up, and sooner or later I make a video about each one of these. But my numbers started creeping up, so his recommendation really was just go get blood, and I pretty much get blood to the Red Cross pretty regularly as it is. So I just started giving blood again. Testosterone is not on the list of medications that preclude you from donating blood. Um, the the option to doing that was to actually go somewhere and have them draw blood off of me, and then I don't know what they would do with that, but I felt like giving blood, donating blood, that could potentially be used in saving a life was the best option for me. So once I started donating blood regularly again, which you can donate every 57 days, once I started donating blood regularly again, that particular issue has never crept back up. So I haven't had any problems with that. The hepatic panel, he just wants to make sure that we're not taxing the liver or causing any issues with liver. Never had anything happen with my liver enzymes or anything like that that would be considered out of the ordinary. My numbers are pretty consistent through there. Estradiol, the male form of estrogen. Initially, I did start having some creeping up, and I got actually above high range. I'll talk in a video about what I did to kind of buffer that. There are chemicals that you can take as far as prescription medications that you can take for estradiol to lower it down. I don't do that. I actually take an herb that has worked for me magnificently. I don't have any issues with that. And then the the total and free testosterone. I mean, that's basically what we're there to test and to see what's going on. He likes to pull both. And then the PSA, there's some notion out there that testosterone replacement therapy actually increases the risk of prostate cancer. So my PSAs have been perfect pretty much the entire time that we've ever monitored them. So I really don't have any issues with that. I imagine that other physicians would pull other things. My doctor is pretty good with pulling that standard 4 panel, and then the pulling the whatever needs to be done when it needs to be done. I really trust him, man. And again, when you're going on TRT, it is a working relationship between you and your physician, right? It's your health, it's your body. If you're dealing with a doctor who is just like off the cuff, not really concerned about making sure that you're healthy and you're in this program, I would really recommend that you go find somebody who is looking at this as a longevity issue, not, you know, hey, I'll just give you whatever you want thing, and we don't really even need to look after your own personal health. This is a longevity issue, and I tell my wife sometimes that the thing that concerns me is you know, my physician mentioned to me, you can't be on testosterone replacement therapy your whole life. You just can't. Like, at some point when you get older, you're going to have to come off, and I dread that. I really do. I don't, he hasn't given me a magic number. There's no, you know, there's no like, hey, when you turn 65 or you turn 70 or whatever, he hasn't. He just has not. But I dread it because I know how I feel on the replacement therapy, and I dread going back to feeling the way that I did before I was on it, because I know what that feels like. And, you know, you put years on your body on top of that, and it's just something I really don't look forward to. So, but those are pretty much the standards that we pull. I actually we have a wellness center where I work, and it's an employee wellness center. We have the option to have blood draws done. If you have a prescription from your physician to have blood draws done, they can pull them for you at no cost. So I don't have to go to an independent lab and get them done, and it don't cost me anything. So we pull whatever he needs to see when he needs to see it. And again, you know, I've said before that my doctor's kind of conservative, so I like that, because again, this is about overall longevity, overall health. I like the fact that he wants to make sure that we're protecting my heart, that he wants to make sure we don't have any issues with the liver. You know, the estradiol stuff, you know, he constantly tells me, he's like, hey, listen, keep doing what you're doing, you know, because you can get gynecomastia. You can actually grow man boobs out of having increased estradiol. So, you know, so when you're working with your physician and blood panel stuff, you know, I understand if you're paying for all that out of pocket, that can be pretty expensive. But all of those panels are important, and there's something that you should want. You should really want to continue to measure those. Matter of fact, I actually keep an Excel spreadsheet in the computer of all my successive labs, and I put them all in there when they get done, and I monitor them. And if there's something that, you know, I have a question about, I speak to my doctor about it at the appointments, and I try to ask him, you know, hey, like, what can be the ramifications of this? This number's slowly creeping up. You know, what can cause that? What can I do to help keep it from happening? Is it a concern? This is about your health, and you have to be in charge of your health. Your doctor may see 30, 40 patients a day, and he may like you, and he may remember your name, and he may kind of remember what's going on with you. But when it comes to your body, your health, you're going to be the one who's in charge of that for the rest of your life. And you need to stay on top of this. And if there's things that concern you or things that you have questions about, take the time at the doctor's office to ask questions. Because, you know, this may be something where you end up having to go see another doctor because the other doctor is going to be a better fit for you. And if that's the case, you want to be informed and educated, and you want to know what you're talking about. So, yeah, those are standard blood panels that we pull. And if you guys are pulling anything different, I'd love to hear what you're pulling. And if you know the reason why your doctor is pulling them, put them in the comments below, because I'd love to hear, you know, exactly what else anybody's pulling. All right? So, Trickortrauma, you guys have a good day.